Alberta Health Services wants all Albertans to live the longest and healthiest life possible. Strategic clinical networks will have a direct impact on patient care by leading us in creating the best performing, publicly funded health system in Canada. The Surgery Clinical Network has been developed with a goal to standardize quality and safety of surgery in Alberta.
The Safe Surgery Checklist, as the name implies, is a checklist that's performed at different parts of a surgical procedure, usually just before the patient goes to sleep, then just before the incision's made, and then right after the procedure's done.
The Safe Surgery Checklist was initially developed by a panel of experts with the World Health Organization. It has been proven to significantly decrease mortality rates and decrease complications after surgery. Not only has it improved patient outcomes, but it has also meant major improvements in the OR during surgery.
The other benefit is that it improves teamwork within the operating rooms. The teams are sometimes selected the morning of the surgery, and therefore everybody, with using the checklist, everybody gets to communicate their parts of the procedure and their concerns before the procedure is done.
The Safe Surgery Checklist makes everyone stop 3 times during somebody's surgery and make sure that everything has been checked off of this list.
The Safe Surgery Checklist is divided into 3 parts. The first is called the briefing, which is done prior to the patient going to sleep.
The patients have quite an active role. They're awake for the first part of the checklist, and so they're actually being introduced to all of the team members in the room. They get to hear, again, what the surgeon has planned for them. They get to hear that everybody is ready and are focused on what they're going to be having done.
Surgical concerns are also addressed. All the equipment is checked to ensure that it is working. Surgical tools are checked to make sure everything that is needed is in the OR. The checklist also helps the team make sure that the correct imaging is up on the computer.
The second part is a timeout, where once we have all the drapes set up, the patient's position, prepared to sleep, before we actually make the skin incision, we have a short timeout where we make sure that all the team members know each other, they know their roles. We also make sure to go over the consent again, go over the procedure, which side it's supposed to be, which level it's supposed to be, and then make sure that all our instruments are working before we start cutting skin.
The third part of the checklist summarizes everything. How did the surgery go overall? Making sure that sponge and instrument counts are correct, and most importantly, how did the patient do medically during the procedure?
Nowadays, with the checklist, I haven't seen any big events, but there's all kinds of small little things that happen every day, like us reminding the anesthetist that the patient needs antibiotics before the surgery starts, anesthesia reminding us of certain medical issues like sleep apnea that will have an effect on the patient's recovery post-op.
The Safe Surgery Checklist has opened the door for communication. ORs used to be historically sort of a top-down, surgeons sort of controlled the room and/or an anesthesiologist controlled the room, and everybody sort of functioned in their own little bubble doing their own thing. Safe Surgery Checklist brings us all together.